Hi there, I'm Dr. Virgil, otherwise known as Dr. V, board certified pediatrician and expert in all things related to infants and children through their teenage years so that your families can thrive. I am typically at the Children's Wellness Spot on Apple or Spotify, where I host a relaxed conversation about the health and wellness of children and families. But today, I wanted to take a little bit of time to talk to you in person about measles, because a lot of people are talking about measles. It's on social media. I'm having conversations about it in the office. And so I wanted to give everyone a few tidbits about measles because there's a lot of misinformation that's going around and circulating. So number one, this is not a lot of hype. Measles is highly contagious. It is probably one of the most contagious viruses that we deal with in the world of pediatrics. So number two, what are the symptoms? The symptoms are fever, cough, congestion, redness of the eyes, which we call conjunctivitis, without drainage, and then a rash that goes from head to toe. As I say that, you're probably thinking that sounds like every virus you've ever dealt with, and it is very nonspecific, which makes it so challenging. However, communication with your pediatrician and trusted providers is so important, because number three, it is very important to know your child's vaccine status and your own vaccine status. We typically vaccinate children for measles, to protect against measles, at the age of 12 months to 15 months, and then give them a booster, which is an additional vaccine at 4 to 5 years of age. So those vaccines, that vaccine series is very protective against measles. So knowing your child's vaccine status is really important, because measles itself, at number 4, has no cure. So that means that we supportively treat and take care of patients. So making sure they stay hydrated, making sure they're breathing well, making sure their fever is controlled so that they're comfortable. We are not certain what child will have a bad outcome from measles. So who will go on to develop things like pneumonia, where they need to be on a ventilator, or encephalitis, where there's swelling of the brain, or other complications with the eyes. So we protect all children who can be vaccinated to prevent the potential of illness and unfortunately death. And we do know that there have been some cases of children who have passed. So in addition to there being no treatment, I also want to remind us all that vitamin A is not a treatment. We give vitamin A when children are exposed to measles or have measles symptoms to protect them from the visual issues that can happen as a result of measles infections, okay? It's not a treatment, it's not a cure. So I hope that's helpful to you. I hope that calms your nerves a little bit. I'm happy to answer questions in the DMs. These are not a replacement for care provided by your provider or other emergency needs, okay? This is just an opportunity for me to share with you all what I know and help inform you in a world that is full of misinformation. So check me out at the Children's Wellness Spot if you'd like to talk some more and hear a little bit more about measles. Otherwise, be well.